You look at a Boston Terrier and you think, cute, dapper little guy, that black and white coat, the big round eyes, the whole miniature gentleman thing they fought going on. And yeah, they are cute. Nobody's arguing that. But there's this weird disconnect, right? Like we bred a dog to look like a cartoon character and then just didn't talk about what it cost them. And it cost them a lot. Boston Terriers are one of the most popular breeds in the country, have been for decades.
They're everywhere. Instagram, TikTok, those little matching pajama photos people do at Christmas. And I get it. They've got personality, they're funny, they're compact enough for an apartment. They check a lot of boxes. But the stuff that makes them look the way they look, the flat face, the big eyes, the stocky little frame, that's not just aesthetics. That's structural, that's skeletal, that's the result of, 100+ years of selective with women for traits that look great in photos and function terribly in being a dog.
And the thing is, most people who get one have no idea. They're not doing it on purpose. They see the face, they fall in love, they bring one home, and then 6 months later, they're at the vet going, why does he breathe like that? Or is it normal that his eyes just do that? It's not normal. None of it's normal. We just decided it was. So yeah, the Tuxedo's cute, but underneath it, kinda grim.
Okay, so there's a term, brachycephalic. Brachycephalic means short-headed, and it's the clinical way of saying, we squished this dog's skull for cosmetic reasons, and now everything inside it doesn't fit right. Boston Terriers have one of the most compressed skulls of any breed. The bones are shorter, the airways are tighter, the soft tissue didn't shrink to match. It all just got crammed in there. Like packing a suitcase that's 2 sizes too small, and then wondering why the zipper keeps popping. And it's not one problem, it's a cascade. The shortened skull pushes the eyes forward. That's why they bulge like that. Makes them more prone to ulcers, scratches, prolapse. Yeah, prolapse. The eye can literally pop out of the socket. It's more common than you'd think, and it's exactly as horrifying as it sounds.
Then the jaw. The teeth don't line up because the jaw's too short for all of them, so you get crowding, misalignment, dental disease way earlier than in a normal muzzled dog. Some of them can barely chew properly. And the spine. This one gets overlooked. Boston Terriers have a high rate of hemivertebrae. That's where the vertebrae are shaped wrong, wedge-shaped instead of rectangular. Sometimes it's fine. Sometimes it pinches the spinal cord, and you're looking at pain, mobility issues, surgery in a 3-year-old dog. None of this is bad luck. None of it's random. It's engineered. Not on purpose exactly, but not by accident either. We kept picking the flattest faced dogs and breeding them together, and this is what we got. A dog that looks adorable and is structurally compromised from birth. "90 degrees out and your Boston's already wheezing on the porch. That's not drama, that's physics. That flat face, the one everybody thinks is so cute, it's basically a design flaw when it comes to cooling down. Dogs don't sweat like we do, they pant. And panting only works if the air has room to move through the nasal passages, which, in a Boston, there's barely anything there. The airways are shortened, the nostrils are narrow, the soft palate is too long for the skull it's stuffed into. So when it's hot, genuinely hot, not just warm, your Boston is trying to thermoregulate through a system that's half broken from birth. And it doesn't take much. You don't need a heat wave. 85 degrees, a little humidity, maybe a walk that goes 10 minutes too long, that's enough. Their core temp spikes faster than you'd think, and they can't bring it back down the way a lab or a shepherd can. It just stays up there. And once you're in heat stroke territory, the window to fix it is tiny.
I think a lot of people underestimate this because Bostons are small. They look sturdy, they act tough, but that compact little body is actually working against them. Less surface area to dissipate heat, more muscle mass relative to size generating it. It's a bad combo. The kind of brutal truth is summer for a Boston isn't just uncomfortable, it's genuinely dangerous, and most owners don't find that out from a vet, they find it out from a scare. Those big, round, bulging eyes, everybody loves them. They're like, I don't know, cartoon eyes. Expressive, adorable, and also incredibly vulnerable. Boston Terriers have what's called brachycephalic ocular syndrome. Fancy term. What it means in practice is their eye sockets are too shallow. The eyes literally sit further out of the skull than they should, which means they're exposed to everything. Dust, debris, scratches from bushes, dry air, other dogs' paws during play. Stuff that had bounced off a dog with deeper set eyes can actually cause real damage to a Boston. Corneal ulcers are, God, they're way too common in this breed, and cherry eye, and something called proptosis, which is when the eye actually comes out of the socket. I know, it sounds extreme. It is extreme, but it happens. And it happens more in Bostons than almost any other breed because there's just not enough bone structure holding things in place. Here's what gets me though. A lot of this stuff isn't obvious at first. Your dog's squinting a little more than usual, maybe rubbing their face on the carpet. You think it's nothing. But with Bostons, eye problems can go from minor irritation to surgical emergency kind of fast. Faster than most people expect. And the vet bills? Look, I'm not trying to scare anyone, but eye surgeries for dogs aren't cheap. We're talking anywhere from $800 to $3,000 depending on what went wrong, per eye. Some of these dogs end up needing multiple procedures over their lifetime. It adds up in a way nobody warns you about at the breeder. Bostons don't complain. That's the reputation anyway. Tough little dogs. Happy, goofy, always wagging. And yeah, mostly true. But that toughness is actually kind of a problem. Because here's what happens. A Boston with a collapsing trachea will still try to play fetch. A Boston with chronic back pain will still jump on the couch and greet you at the door like nothing's wrong. They mask it. Not on purpose, obviously, they're dogs. But something about the breed's temperament means they push through discomfort in a way that makes it really easy to miss. Spinal issues are a big one. Bostons are prone to hemivertebrae, and that can pinch nerves, compress the spinal cord, cause pain that builds so gradually the dog just adapts. You might not notice anything until they start dragging a back leg or can't hold their bladder anymore. By then, it's been going on for months, maybe longer. And the breathing stuff, I already talked about heat, but it's not just heat. A lot of Bostons are struggling to breathe comfortably every single day. The snoring that people think is cute, that's obstructed breathing. The snorting after a short walk, obstructed breathing. They normalize it because it's all they've ever known, and owners normalize it because everybody told them Bostons just sound like that. I think that's the part that gets to me most. The suffering that looks normal. The pain that gets mistaken for personality. Nobody's being negligent. They just don't know what they're looking at. And the dog sure isn't going to tell them. Over 80% of Boston Terrier litters are delivered by C-section. 80! That number should stop you cold, and it usually doesn't, because nobody mentions it at the breeder's website. They're too busy posting puppy photos. The reason is kind of darkly simple. We bred their heads too big for their bodies. The puppy skulls are wider than the mother's birth canal. So without surgical intervention, a lot of these dogs just can't give birth.
not safely, not without serious risk of losing the mom, the pups, or both. And look, C-sections aren't some casual thing. You're talking general anesthesia, a vet on standby, ideally one who's done this before, and a bill that starts around $1,500 and goes up from there, per litter, every time. Some breeders just build it into the budget. Like it's a line item: puppy food, vaccines, mandatory surgery to allow the species to reproduce. That's where we are. I think most people hear brachycephalic and they think breathing problems. And yeah, we'll get there. But the reproduction thing is, it's more fundamental than that, right? We're talking about a dog that literally cannot sustain itself as a breed without human surgical intervention. That's not a health issue. That's a design flaw baked into the animal at a structural level. And the thing that gets me is how normalized it's become. Breeders don't apologize for it. They don't even flag it. It's just the cost of doing business. You want a Boston? Cool. Just know that the breed's continued existence depends on a scalpel. About 10 to 12% of Boston Terriers are born deaf in one or both ears. And the kicker is, most owners have no idea. Not because they're negligent, because unilateral deafness in just one ear, is genuinely hard to spot. The dog compensates, turns its head a little more, relies on vibrations, on sight, on context. You call its name, it comes. You think everything's fine. It's linked to pigmentation, specifically to the white markings Bostons are famous for. The same gene that gives them that tuxedo pattern, the one everybody loves, the one the breed standard rewards, is associated with a higher incidence of congenital deafness. So the very thing that makes a Boston look like a Boston is, in some cases, the thing that's taking their hearing. And there's a test for it. Bayer testing. Brainstem auditory evoked response. Takes maybe 15 minutes, costs a couple $100. It's the only reliable way to confirm hearing status in puppies. But most breeders don't do it. Some don't even know about it. Others know and just skip it. Because a deaf puppy is a harder sell. And if you never test, you never have to disclose. I'm not saying every breeder is being shady. Some genuinely don't realize the prevalence. But when you've got a breed where 1 in 10 dogs might be partially deaf, and the testing exists, and it's cheap, the fact that it's not standard practice is, kind of indefensible. The dogs do fine, by the way. Deaf Bostons adapt remarkably well. That's not the point. The point is you should know before you're 3 years into ownership, wondering why your dog ignores you from the left side.
Boston Terriers have one of the highest rates of hemivertebrae of any breed, and if you've never heard that word, most people haven't, it means some of their vertebrae are shaped wrong, wedge-shaped instead of rectangular, sometimes from birth, sometimes detectable only on X-ray, sometimes not causing any visible problems until the dog is 2 or 3 years old and suddenly can't control its back legs. The tail is actually the tell. That cute little corkscrew tail, the nub, the tight spiral, that's a visible hemivertebrae. It's a malformed vertebrae you can literally see, and breeders select for it.
The breed standard basically requires it. So you've got a situation where the cosmetic trait people associate with the breed is, structurally speaking, a spinal deformity. And nobody frames it that way because, it's the tail. It's cute. Who's going to argue with the tail? But here's where it stops being cute. Those same malformations can show up further along the spine, in the thoracic region, the mid-back. And when they do, they can compress the spinal cord. The dog starts walking funny, loses coordination, pain that's hard to localize, hard to treat. In bad cases, you're looking at surgery that runs $5,000 to $10,000. And even then, outcomes are mixed. That's the generous word.
And the frustrating part is, a simple x-ray of the spine before breeding could flag the worst cases, screen the parents, reduce the incidence. But it's not required. It's not even strongly recommended by most breed clubs. So the same vertebral defect that gives Boston Terriers their signature look keeps getting passed down generation after generation, because it's what the standard says of Boston should look like.
You leave for work, normal morning, nothing dramatic, and your Boston Terrier just falls apart, like genuinely falls apart. We're not talking about a dog that gets a little mopey by the door. We're talking about a dog that will chew through drywall, scratch at a crate until its nails bleed, bark, not normal barking, that panicked, repetitive, almost mechanical barking for hours. Your neighbors know. Trust me, your neighbors know.
Boston Terriers have separation anxiety at rates that are honestly kind of alarming. And I think most people who get one have no idea what they're signing up for. You see the cute tuxedo face, the goofy personality, the compact size that works in an apartment. Nobody mentions that this breed bonds so hard to its person that being alone feels like an emergency. Not an inconvenience, an emergency. And here's what makes it worse. You can't just train it out of them the way you would with, I don't know, a lab who gets into the trash when you're gone. This is chemical. It's in their wiring.
These dogs were bred to be companions. That's the whole job description. Sitting next to you, being near you, following you from room to room. Which, yeah, they do that too. Every room, bathroom included, especially the bathroom, actually. So you crate train, you do the gradual departures, you leave a shirt that smells like you try the calming supplements. And some of it helps, kinda, but the baseline anxiety, that's just there. It's baked in. You're not fixing it, you're managing it. Every single day for the life of the dog.
That snoring thing Boston Terriers do, the little snorts and wheezes that people think are cute, that's not personality, that's obstruction. It's called BOAS, Brachycephalic Obstructive Airway Syndrome, and it's basically a collection of anatomical problems that all add up to one thing. This dog cannot breathe properly. Not during exercise, not during sleep, sometimes not even just standing there on a mild day. The nostrils are too narrow. The soft palate, that flap of tissue at the back of the throat, is too long for the shortened skull, so it droops into the airway. The trachea might be undersized. Some of them have everted laryngeal saccules, which is where the tissue near the voice box gets sucked into the airway because the dog is pulling so hard just to get air in. Think about that for a second. The dog is working so hard to breathe that it's pulling its own throat tissue into its airway, and we call the sound it makes cute. I mean, look, not every Boston has it severe. Some are mild, some you'd barely notice.
But studies have put the number at something like 60 to 70% of brachycephalic dogs, showing at least some degree of BOAS. And a lot of owners don't even recognize it as a problem, because that's just how their dog sounds. That's just what a Boston does. It's not what a dog does. It's what a dog with a deformed airway does. There's a difference. The surgery to correct it, widening the nostrils, trimming the soft palate, runs you anywhere from $2,000 to $3,000, depending on the vet. And it helps, but it's fixing something that shouldn't have been broken in the first place. %. That's the number I kept running into when I was reading about Boston Terriers and skin issues. 62% of owners reporting some kind of recurring allergy problem. And once you see that number, everything clicks. The forums full of people trying elimination diets, the vet bills that just never stop, the dogs wearing little cotton shirts in July because they've scratched themselves raw. Bostons are predisposed to atopic dermatitis,
which is a fancy way of saying their immune system freaks out at stuff that shouldn't be a problem. Pollen, dust mites, certain proteins in food.
Sometimes, and this is the one that really gets me, sometimes you never actually figure out what's triggering it. You just manage. Again with the managing. The itch cycle is brutal. Dog gets itchy, dog scratches, skin gets inflamed, bacteria or yeast moves in. Now you've got a secondary infection on top of the original allergy. So you treat the infection. Skin heals. Allergy's still there.
Dog gets itchy again. Repeat, repeat forever. And the food thing is its own maze. You switch to limited ingredient. You try novel proteins, venison, rabbit, kangaroo, stuff that sounds like a menu at a restaurant you can't afford. Maybe it helps, maybe it doesn't.
Maybe it helps for 3 months and then stops helping, and you're back to square one with a dog that's licking its paws until they're stained brown. I think the part people aren't prepared for is the permanence of it. This isn't a problem you solve. It's a condition you live with, your dog lives with. And some weeks are fine, and some weeks you're at the vet again, dropping another $200 on medicated shampoo and steroids.
"4 a.m, dead quiet. And then your Boston makes a noise that sounds like a 60-year-old man choking on a peanut. You bolt upright, heart pounding, and the dog's just sleeping, totally fine. That's just how it breathes. Brachycephalic airway syndrome. That's the clinical term.
Short skull, compressed nasal passages, elongated soft palate, sometimes a trachea that's narrower than it should be. All of which means your dog is working harder to breathe than a dog should have to. Not during exercise, not during stress, just always. Sitting on the couch, walking to the kitchen, sleeping. The snoring is the part people think is cute. And okay, yeah, it's a little funny at first, like living with a tiny freight train. But what's actually happening is your dog's airway is partially obstructed. That's what snoring is. And when it gets worse, when it goes from snoring to that reverse sneeze thing, that honking, gasping, won't stop till you cover their nostrils trick, that's the airway collapsing. Temporarily, but still. Heat makes it worse. Exercise makes it worse. Excitement makes it worse. I read one study that said over half of brachycephalic dogs show signs of respiratory distress during normal play. Normal play. Not running a marathon, playing fetch in the yard. Some Bostons end up needing surgery. Soft palate resection, nostril widening. It's not cheap and it's not minor. And even after surgery, there's still a brachycephalic breed. You've improved the airway, you haven't fixed the skull shape, so you learn to live with the soundtrack, the snorts, the gurgles, the 3 a.m. choking that turns out to be nothing. You adjust. The dog doesn't know any different, which is maybe the saddest part of all of it. Talk to a vet off the record, like actually off the record, not the polished stuff they say in the exam room, and Boston Terriers come up fast. Not because they're bad dogs, because they're expensive patients who don't know they're sick. The face is the problem. That flat, smushed, adorable face that everybody loves, it's a structural disaster. The medical term is brachycephalic, which basically means the skull got compressed, but everything that's supposed to fit inside it didn't get the memo. So the soft palate's too long, the nostrils are too narrow, the trachea's undersized, and the dog just lives like that, snoring, snorting, gagging a little after exercise. Owners think it's cute. Vets hear it and wince. And here's what gets me. A lot of Boston owners genuinely don't realize anything's wrong. The breathing sounds are so constant, so built into the breed, that people just normalize them. Oh, that's just how Bostons sound. Yeah, that's just how a dog with a partially obstructed airway sounds.
not the same thing. So the vet's in this weird position. They're looking at a dog who can't breathe properly, whose eyes are bulging out of shallow sockets, which, by the way, makes them way more prone to corneal ulcers, which is exactly as painful as it sounds. And they have to explain to someone who loves this dog that the thing they find most charming about it is kind of the thing that's hurting it. Most vets I've read about handle it diplomatically, but you can tell there's a frustration there, not at the owners, at the situation. Dogs cool themselves by panting. That's it. That's basically the whole system. And panting works by moving air rapidly over the moist surfaces inside the mouth and throat. So if those airways are already compromised, already narrow, already partially blocked, you've got a cooling system that's running at maybe 60% capacity on a good day. Boston Terriers overheat fast, like alarmingly fast. A 15-minute walk in 85-degree weather can push some of them into genuine distress, not discomfort, distress. Heavy panting, drooling, wobbling, sometimes collapse. Heat stroke in a Boston can go from he seems a little warm to an emergency vet visit in, 20 minutes, maybe less. And the thing that kills me is how preventable it is, but people don't know. They see a small, energetic dog and think, okay, quick walk around the block, it's fine. It's not fine. Not in July, not in direct sun, not on hot pavement, which, by the way, also burns their paw pads because they're so low to the ground. Winter's a different problem, but the same root cause. Boston Terriers have almost no body fat, a thin single coat, and a compact frame that loses heat quickly. They're not built for cold. Below about 40 degrees Fahrenheit, most of them start shivering pretty fast. Some owners put them in coats, which, honestly, it looks ridiculous, but it's the right call. So you've got a breed that can't handle heat because of the breathing and can't handle cold because of the build. The comfortable window is, 60 to 75 degrees? That's narrow. That's really narrow. Boston Terriers have one of the highest rates of heart murmurs among small breeds, and not the benign kind you hear about in puppies that they grow out of, the kind that gets worse. The big one is mitral valve disease. The valve between the left atrium and the left ventricle starts to degenerate, slowly over years, and it stops closing properly, so blood leaks backward with every heartbeat. The heart works harder to compensate, it enlarges, and eventually, if it progresses far enough, you're looking at congestive heart failure. Now, and this is the part that really bothers me, the early stages are basically silent. The dog acts normal, plays normal, eats normal. Maybe there's a slight cough, maybe not. A vet might catch a murmur during a routine checkup, but a lot of owners skip those annual visits once the puppy shots are done. So the disease just sits there, quietly getting worse. By the time symptoms show up, the coughing, the exercise intolerance, the labored breathing at rest, you're often already at a moderate to advanced stage, and treatment at that point is management, not cure. Medications to reduce fluid buildup, lower blood pressure, help the heart pump more efficiently. It works. Sort of. It buys time. But it doesn't fix the valve. Some Bostons live years on cardiac meds and do great. Others decline faster. There's a genetic lottery aspect to it that's honestly kind of brutal. You can do everything right, good diet, good weight management, regular vet visits, and still end up with a dog whose heart was just built wrong from the start. That's the part nobody warns you about at the breeder. Nobody warns you. You bring home this little tuxedo-wearing goofball,
And within about 48 hours, your living room smells like something died under the couch. And it didn't die under the couch. It came out of your dog. Boston Terriers are, and I cannot stress this enough, some of the gassiest dogs on the planet. Like legendarily gassy. We're talking clear the room, wake you up at 3 a.m., guests politely asking if something's wrong levels of gas. And it's not a sometimes thing, it's a daily thing. Multiple times a day, sometimes multiple times an hour. And the reason is mostly structural. That smushed face, the brachycephalic thing, means they gulp air when they eat, every single meal. They can't help it. Their whole airway situation is just compromised, so they swallow air, and that air has to go somewhere, and it goes exactly where you think it goes. But it's not just the face. Their stomachs are weirdly sensitive too. Like, a lot of Bostons can't handle grain-heavy kibble, or chicken, or honestly, sometimes they just react to food in general.
You switch brands, it gets worse. You switch back, still bad. You try the expensive stuff with the fancy probiotics and the limited ingredient list, and your dog still smells like a sulfur mine. I think people don't talk about this because it sounds trivial. It's farts. It's funny. Except when you're living with it every day and your whole house has this permanent low-grade funk, it stops being a joke pretty fast. And it can actually signal real digestive issues, food allergies, IBD, stuff that needs a vet, not just a candle. You'll see it everywhere. Boston Terriers live 11 to 13 years. And that number is technically accurate. In the same way that saying the average human is 5'7" is technically accurate. It tells you almost nothing about any individual case. Here's what that number hides. A lot of Bostons don't make it to 11. Some don't make it to 8. And the ones that do hit 13 are usually the genetic lottery winners. Good breeding, good luck, fewer of the structural problems that plague the breed. The median is not the story. The spread is the story. Because the stuff that kills Bostons early isn't like rare. It's baked into the breed. Heart murmurs, collapsing tracheas, mast cell tumors, which, by the way, Bostons are predisposed to at a rate that should probably freak more people out than it does. Brain tumors, Cushing's. The list is kind of relentless, honestly. And then there's the breathing. The brachycephalic airway syndrome thing isn't cosmetic. It's not just snoring. It's a dog whose body is working harder than it should to do the most basic thing, get oxygen. That wears on the heart. That wears on everything. Over years, it compounds. I think the lifespan number gets repeated because it sounds fine. 11 to 13? That's a normal dog lifespan.
Nothing to worry about. But the quality of those years, how many are spent at the vet, how many involve chronic management of something, that part gets left out. And I kind of think it gets left out on purpose. Breeders aren't exactly lining up to tell you your puppy might need surgery before it turns 3.
A friend of mine, well, not a friend exactly, someone in a Boston Terrier forum, posted their vet receipts from 1 year, $4,700. And this wasn't an emergency year. No car accidents, no swallowed toys, just maintenance.
Skin infections, eye drops, an allergy panel, 2 rounds of steroids, and a consult about the dog's breathing. That's what people don't budget for. You look up Boston Terrier cost, and you get the puppy price, somewhere between $1,500 and $3,000, depending on the breeder. Maybe you factor in food, shots, basic stuff. But nobody's budgeting for the cherry eye surgery at 14 months, or the soft palate resection at 2, or the recurring skin thing that never fully goes away and requires medicated baths every week, plus a prescription food that costs $60 a bag. Their eyes alone are a whole financial category.
Bostons have these big, gorgeous, bulging eyes that are basically unprotected. Corneal ulcers, dry eye, cherry eye, which sometimes comes back after surgery, by the way, so you get to pay for it twice. I looked up average cherry eye surgery costs, and it's somewhere around $500 to $800 per eye. Per eye. And the breathing surgeries, if your Boston needs tonade nares or soft palate work, you're looking at $2,000 to $4,000. Easy.
Some vets charge more. I guess my point is, the purchase price of a Boston Terrier is the smallest check you'll ever write for that dog. And I think a lot of people find that out the hard way, about 18 months in when the credit card starts getting heavy.
Look, I know this whole video has been a downer. That's fair. It is a downer. You came here to learn about Boston Terriers, and I've spent the last however many minutes telling you all the ways they're quietly falling apart from the inside out. But here's what I want you to actually take from this, not just nod along and click off and never think about it again.
The Boston didn't ask for any of this. The flat face he was born with, a spine that grows wrong, eyes that bump him in the wrong spot and they're literally out of his skull, lungs that give up on him in 80-degree weather. None of it was the dog's idea. We did this. Breeders, judges at dog shows, people who wanted a smaller, smushier Boston because they thought it was cuter than a slightly longer-nosed one. Generations of choices made by humans, paid for every single day by the dog.
And the dog. God, he has no idea. That's the part that gets me. He doesn't know he's supposed to breathe easier than this. Has no clue his hips shouldn't grind every time he stands up. He just thinks this is what being a dog feels like. So he wags, climbs in your lap, snores against your chest while you laugh because it's cute. And meanwhile, he's basically suffocating in slow motion every night of his life. So if you have one, love him, obviously. But love him with your eyes wide open. Don't let him overheat. Don't let some idiot at the park tell you he's just being lazy when he can't finish the walk. He's not lazy. He's running out of air, and you can't see it happening from the outside. And if you're thinking about getting one, I'm not going to tell you what to do. That's your call. I'll say this much, though. Go meet the parents.
Ask about the C-section history. Ask about deafness in the line. A decent breeder will sit there and answer every awkward question you throw at them. A bad one will get weird about it real fast. Pay attention to which one you're talking to. These dogs deserve better than what we've done to them. They really do. The least we can do, the absolute least, is understand what we're asking of them when we bring one home. That's it. That's the plea.